Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I am Coach Kyle.
And I'm Dr. K. Thank you for joining us today as we discuss testosterone and hormones part 2. So today we're going to get into all the stuff that we left out last time. Alternatives to direct testosterone replacement, a couple other supplements that you can take, and not necessarily supplements, more so medications. We're going to talk about how detox can affect your hormone pathways. Let's get into it.
Let's do it. So, Dr. K, how you doing?
I'm doing great today, Kyle. How are you?
Good. Aren't you leaving in a few days to go across the Sahara on a horse?
Part of that was true. 2/3 of that was true. I'm leaving in 5 days, and it is a horseback adventure, but not the Sahara. We're going to Botswana in Africa.
That's very cool. So, is your horse riding up to par now? Because I know you didn't know how to ride a horse a while ago.
As of June 30th of last year, I had no idea how to ride a horse. Started July 1st. I think I'll be okay. No, if this podcast suddenly disappears from the internet, it means I got eaten by a lion. But
please avoid the lions when you're out there. Oh goodness. Well, before we jump in, I have to tell you, I was at a conference last weekend, and I had the honor of going to Dave Asprey's house and hanging out with him for a little bit. I was a little bit of a fangirl because I followed Dave Asprey for so long. He's actually been a pivotal person in my health journey because he's the reason that I know you. So his conference is where I met the doctor that referred me to you. So I got to actually hang out with him for a little bit, and he made me a Danger coffee espresso at his house. I was like, wow, this is really cool. But the point of this, besides me just fangirling or fanboying, I don't know, is, sometimes people say don't meet your idols, and because they might turn out to not be who you think they are. And Dave Asprey is one of those people that is he's better than you hear on the podcast. In person, he's a real human. He's engaging. He's empathetic. He's kind. He is a cool guy to hang out with. So I just figured I'd put my 2 cents out there because I see a lot of people hating on his stances on things. But, regardless of what they say, I've met him in person, hung out with him. And it was really cool to see that he's a human.
Very cool. You've made it when you have your first hater.
Yeah. I don't think we have a hater yet. Do we have a hater? That's a person who hates my exercise bike. Calling you out again. Oh my goodness. Okay, let's get into it. So, as a recap of last episode on testosterone, which if you're listening, you're probably just rolling right to the next one. But testosterone, very important for both men and women. It's a key element in how your body basically produces the feeling of drive or will to do things, to succeed, to live life well. It also governs a lot of things like sex function, body composition, other things. We talked about supplementation, how we don't really like supplements and the supplements that are out there because they're a very mild effect on testosterone, if any, and they're relatively expensive, and there's so much hype and crap out there that it's hard to navigate. We also talked about the types of testosterone replacement therapy or testosterone optimization therapy, how you can do it: injections, creams, gels, pill, and pellets. And then we alluded to, but wait, there's more. And then at the end of the episode, we talked about, don't go on testosterone replacement therapy without having a plan to maintain your fertility. So that's kind of where we left off. Do you want to start by telling us why we don't want to go on testosterone if we want to remain fertile and have children?
Yeah, so just like any other supplementation hormone in the body, if you give your body enough of something, it's going to say, hey, great, I don't need to make any more of it. And then it shuts down its own pathways. And the longer those pathways stay shut down, the harder it is for the body to restart them. Basically, the way the body works is it works on receptors, right? Let's say there's 1,000 testosterone receptors. And when 800 of them are full, the body says, okay, stop production, wait until we're back down to 600, wait for 200 to get used and kick back on. Kind of like a pump. And then if we suddenly start taking in 1,000 testosterone and all 1,000 of our receptors are full, our body's pump never has to kick on to restart our own system.
And so over time, this leads to like an atrophy of the system, essentially,
Yes.
where it might just go offline for some people or take years to come back.
Yep.
And that's why a lot of people say when you go on testosterone, it's a lifelong thing. But it doesn't have to be if you do it correctly or intelligently. If you don't want it to be, and that's a big point. Before we dive into ways we can approach this and maintain fertility, I would like to talk a bit about the reasons why you wouldn't care. So if you're an older gentleman and you don't want to have kids and you don't care about fertility, then I wouldn't worry about any of these things we're going to talk about because, at the end of the day, downregulate, and you're okay with staying on testosterone for the rest of your life because that's a big point. At the end of the day, you're not worried about having children. And if you can have the optimal testosterone levels all the time, then that's what you're going to do. And that's a choice you can make. The other benefit to being on testosterone and not using, testosterone alone or testosterone in conjugation with one of these strategies we're going to talk about, and not just these other strategies, is that these other strategies work more naturally in the body to increase testosterone production, which gives you this kind of ebb and flow naturally. Whereas testosterone injections give you that up, and then you can maintain it pretty well high. So you feel a little better around the clock, is what I've found, at least in my experience. Mm-hmm. So why don't we go ahead and jump in? So I think the best way to start this is to tell people, like, when you put someone on testosterone who wants to maintain fertility or maybe doesn't want to do it for the rest of their life, how do you approach it?
So there's two options, and let's talk about the first option we're going to talk about is maintaining fertility while taking direct testosterone replacement, which is there's two different ways to do it. One is a peptide called gonadorelin. And on today's date, I still believe that we can get gonadorelin. It was not one of the ones that was shut down by the FDA. I ordered some for a patient a couple weeks ago. Or it's commercially produced alternative HCG. Both of these, they keep your FSH and LH pathways open to force your body to keep making more of your own so that your own testosterone production never declines.
So can you give us a quick synopsis about LH and FSH and just kind of how that works?
I will try and keep this simple because hormones are one of the most complicated things out there. So I alluded to receptors before, right? And feedback loops. And so if you guys have listened to our thyroid talk before, it's a similar idea. A receptor starts in the brain, comes down into the other part of the brain, and then goes into, in guys, the testes, and women, the ovaries. And from there, more hormones are made, and then eventually spit out testosterone and estrogen. That's a really simple way, up in the sky overview of it. But the details don't really matter for the common person, honestly, where they're made. But that's the idea. As the trickle down, you make 500 FSH, that turns your body into saying, hey, I need to make 300 testosterone, and that loop continues. And then waits for one to die down and kicks up.
So basically, FSH and LH are the, more or less, to hyper simplify it, are the signals to make testosterone.
Yes.
Okay. I think it's also important to note here that if your LH and FSH are very high through one of these strategies, but you have a testicular injury, meaning your body is unable to produce the actual testosterone, it will not matter what the signal says. Is that correct?
Yes. Yeah, okay. It's like you can't squeeze blood out of a stone. Once it's dry, it's dry.
Yeah, so these strategies will not work for someone who has a testicular injury. And believe it or not, it's more common than we would like to admit with all the sports and especially young people getting into sports early nowadays.
Yeah, so for people like that, they need just straight testosterone. Other stuff just doesn't matter.
Yeah. So, and that's very important because if you have a testicular injury, you don't need to worry about these other strategies. You just need to know that if you want to optimize your testosterone levels, which you probably need if your body's not producing testosterone from a testicular injury, you're going to be on it for the rest of your life because of that injury. Yep. Okay. Moving forward. So you said you put someone on gonadorelin or HCG along with testosterone injections. Can you tell us like what it looks like?
Yeah, so most of my people are on testosterone injections twice a week. That's just that's the minimum, easiest one. Like we talked about before, the best thing to do is every day or every other day, but twice a week works for most people. And then gonadorelin or HCG, they are also done twice a week. And we start a similar thing. I have a base dose I start people at. I use gonadorelin. I prefer it. Studies have shown it has it is stronger with less side effects. So I always use gonadorelin as long as I can still get it. But I start people on a similar thing of 0.2 milligrams. I forget its exact dosage, but 0.2 milliliters of it twice a week on different days than testosterone.
Okay, so you do it basically on off days to like help your natural production on those off days.
Yep.
And so again, to simplify this, these HCG or gonadorelin, basically what they do is they go in and they tell the body to make more testosterone, conflicting with the signal of the actual testosterone that is actually reducing the signal to make sure that your natural pathways stay optimized.
Correct.
Okay, so I mean, is that the only route you would do while you're actually on the testosterone injections, or would you do something like Enclomiphene alongside testosterone injections?
I've never put someone on Enclomiphene along with testosterone. Doesn't sound like the worst idea. I've just honestly never thought of doing that.
It is a strategy that people use. I've heard of a few doctors that do it. The downside, in my opinion, is Enclomiphene is much more expensive than the other two options. So, taking Enclomiphene is just a more expensive option or way to do it.
I don't think it's horribly. I mean, it's about $90 for 15 pills, whatever that works out to be.
$90 for 15 pills, roughly. Yeah, I get a quarter of my HCG injections for $200, roughly.
Yeah,
and I take a fairly hefty dose.
Yeah, so it's more expensive, but that just goes to say it's not unreasonably expensive.
Gotcha. So it is something that people could try. I have heard of doctors that do that, running it alongside.
Mm-hmm.
So is this the approach you would try right out of the gate with like a younger male that has lower testosterone, or would you try to use one of these substances like by themselves for?
Actually, you taught me this. Unless they're like a severely overweight older male, I start everyone on Enclomiphene first. It just works so much better, in my opinion, than testosterone. And people don't get tired of poking themselves because it's a pill you take every other day or every day, just depending on what your levels need.
Yeah, that's a big differentiation you made there. The Enclomiphene is a pill, and gonadorelin and HCG are both injections. So there's this whole needle phobia, and again, you get sick and tired of sticking yourself. I don't, because I'm a biohacker and that's just kind of the life I live. But most people prefer Enclomiphene. So you put people in Enclomiphene first, which I really like this strategy because it's basically you're trying to get the most out of your body for as long as you can, right? You just want to send a louder signal to your body to produce more testosterone. So it's basically a staged approach, which you would try something like Enclomiphene or HCG or gonadorelin. Maybe you would dose up 1 or 2 times. And if those weren't working for someone, then you probably have a problem in the testes, at which you would need to move to testosterone injections and then still supplement with one of these other options to maintain fertility.
Correct.
Okay.
So I feel like we've alluded to Enclomiphene. We should talk about how it actually works. Like what's it do?
Yeah. You want to take that one, or you want me to?
You can go ahead.
It's been a minute, so correct me if I'm wrong here, but Enclomiphene is a SERM, so it's a selective estrogen receptor modulator. What it does is it basically blocks aromatization, so the transfer of testosterone into estrogen. And what it does is there's 2 different variations of this drug, and we've seen Enclomiphene, and a lot of people have heard Clomid. Enclomiphene is a different version molecularly than Clomid. And Enclomiphene only blocks the portion that you want to block of the estrogen aromatization. And that by letting there be less aromatization, that helps the LH and FSH kick up, send a louder signal. Did I nail that?
You nailed it better than I could have, actually. You did bring up one distinction, though. Pretty much no one uses Enclomiphene anymore. Everyone is on Enclomiphene. It has less psychiatric side effects. Regular Enclomiphene can cause things like anxiety and depression in guys, whereas Enclomiphene has a severely reduced side effect profile.
And it is sad because in the functional medicine that's well known, but I have heard of a lot of doctors that are not really abreast of the difference. I don't want to poo-poo on doctors, but it's big pharma, really big pharma is because they have the brand name Clomid, and Enclomiphene is a compounded medication for the most part. And so that distinction, Clomid is being pushed by pharma, Enclomiphene is not. But you want to make sure that if you're doing testosterone replacement therapy or something like these, you want to do Enclomiphene. Mm-hmm. So what can people expect in terms of results in Enclomiphene? What have you seen? And I'll tell people what I've seen.
So the first thing I warn people about Enclomiphene, people feel weird the first week or two when they're starting it. Usually mental, sometimes fatigue. So I always warn people about that for the first week or two. It's okay. It will go away as they get used to it. And then after that, so we always retest hormones on Enclomiphene after 2 weeks, and we kind of see where their levels are. Most people have a spike that, it's appropriate for. How high that spike is varies. I've seen it jump 100 points. I've seen it jump 400 points. Because I start people on 25 milligrams every other day, and then after 2 weeks, we evaluate and move from there.
Yeah. So standardized dosing on this is almost every other day. Like the dosing guidelines from like whoever makes it, I've looked it up a few times. They recommend every other day. However, in my experience as a biohacker, every day for me at a lower dosage had way less side effects. And that's just how it worked for me. Do you have patients prefer every other day, or am I just the weird one out here?
Truthfully, I don't think, the common person doesn't really know enough. And, unfortunately, getting people to truly tell you how they're feeling is rare. Most people are like, oh, I feel terrible, or, oh, I'm fine. And getting fine details in between is really hard. So I kind of have to judge most of it by the numbers. And that's just, the human condition.
Yeah. There are, if for the audience, if you ever really want to get into this, there are specific surveys that you can take. There are tested instruments that can basically test and give you a score for your low testosterone symptoms. And so something like that might be helpful for your doctor to help them guide their dosage and medication suggestions. But that's going above and beyond. If you want to, I'm sure your doctor will be very appreciative of your surveys.
Yeah, right.
So let's summarize a little bit. We have Enclomiphene, gonadorelin, HCG. Gonadorelin and HCG are injectables. Enclomiphene is a pill, and they can be taken alongside a protocol with testosterone replacement therapy with like testosterone cypionate or something like that, or they can be taken just by themselves to increase testosterone.
Correct.
So that's where we've gotten so far. We talked a little bit about pricing, but they're not terribly expensive. I think Enclomiphene is more expensive than HCG for me. It's running, what is it? When I was in Enclomiphene, it was probably $500 a quarter, roughly.
Yeah, if you're on it every day, that's about right.
Yeah, daily dose.
So it's $180 a month-ish, yeah.
And then so it's about $200 a month for or $200 a quarter for my HCG, which I take every other day.
Okay. Okay, so the next thing let's talk about is DHEA.
DHEA, the mother of all hormones.
You want to explain what you mean by that?
So I'm not actually really sharp with the science on here, but the layman's terms, the layman's breakdown of it is essentially, I believe that the other sex hormones are synthesized from DHEA. It's kind of an upstream hormone.
Right.
So basically, if you have more of this DHEA, then your body has more of the raw materials to make testosterone.
Yeah.
But
basically, it's made in your adrenals. It stands for dehydroepiandrosterone. I think I pronounced that right. Maybe I didn't. But it's made in your adrenals and a couple other places, and it helps to makes more testosterone and estrogen. Yeah.
So the double-edged sword here is it helps make more testosterone and estrogen. Yep. So it can cause estrogen side effects. And I believe there's a specific type of DHEA called 5-keto-DHEA, which limits the estrogen symptoms of DHEA. So if you're male and you want to supplement with DHEA, I would get the 5-keto-DHEA version of it. DHEA, I think, is probably one of the most efficacious tools for hormonal replacement therapy for women, because it helps bring the whole pool up, and usually people feel a lot better on it from my experience. So, do you use DHEA regularly with your male clients?
I use it more for females. I don't do a lot of female hormones, but for guys, it's rare. But I will, if they're close to where I want them to be and the estrogen is not too high, I will add DHEA just to give them that little extra boost without having to up their testosterone or enclomiphene.
Yeah, I like that. Okay, so I think we've covered them. Is there anything else we need to talk about before we move on? I've got one topic I want to hit.
One more thing about DHEA, if a guy has stubborn belly fat and they can't seem to get rid of it, dosing DHEA, there's been trials that show that doing it for 6 months can actually help get rid of that belly fat.
Wow, that's good to know. I didn't know that one.
Yeah.
Do you know the reason behind that?
No.
They probably don't either. The researchers are probably like, more research needed. I've seen that so many times in research papers. They're like, this is what we found, but we're really not sure about it.
Huh?
So, I mentioned a little bit about estrogen and symptoms. There are some people online and influence, who comes to mind as Jay Campbell. And he is very pro-estrogen. And I somewhat agree with his stance, and I somewhat don't. But his thought process is that estrogen is very protective, neuroprotective, and protective for your organs. And it also protects you from a lot of the cancers and prostate cancer that people are like scared about with testosterone replacement therapy. I somewhat agree with that, but I also have to say that high estrogen symptoms as a male are a real thing. I've experienced them myself. I've had my estrogen too high during my journey, and I'd be like watching TV with my wife, and a commercial for a Chevy truck would come on. I'd be like bawling. I'm like, it's so sad. And then you get like sensitivity in the breast tissue and mood swings and things like that. And those are general signs that your estrogen's too high. Now, what some doctors do is prescribe an anastrozole. I do not love this approach unless it's done very, very judiciously. Anastrozole can have massive side effects, especially long term. If you're on this medication, it basically blocks estrogen essentially. And so what it does is it reduces your estrogen levels, and it can lead to sarcopenia, bone issues, and possibly some cancers down the road. So if you're going to entertain this is not an everyday medication. There's a very long half-life on it, and the dosage should be very low. Dr. K, you got 2 cents about that?
The unfortunate part is I get a lot of patients that come to me because no one can get their hormones under control, and they're doing hormones at like one of those hormone wellness places, and they put pretty much everyone on anastrozole.
Yeah, that's it. Well, it's kind of the whole like double-edged sword, because if I have a standard prescribed dose of anastrozole for 2 days, I will look shredded. I will look ripped because all of the water and puffiness has drained out of my body, and I have no estrogen. Day 3 and 4, my sleep goes to crap, and then I start getting inflamed again, which throws all the other hormones back off, and it's this like crazy cycle. Yeah. So standard dosage, I think, is like 1 milligram is how the pills come.
Yeah.
And really, some places like these wellness places are recommending 1 milligram a day, which is insanely high. I mean, really, if you have to take these to mitigate symptoms, 1/4 of it, 1/8 of it is probably where you should start, which is annoying because you're like crushing up the little pill. And it's a very tiny pill. Yeah. But I'm of the mind, and Jay Campbell kind of talks to this a little bit. If you're getting high estrogen symptoms, you're probably doing too much with your testosterone replacement. You should probably take your dosage down, whatever route you've gone, and get to a more manageable level. And now this doesn't necessarily follow the numbers. So you could be a person that had 300 testosterone, and you go on one of these therapies and you have 500, but you start getting estrogen symptoms. Now, what that means is most likely you need to live at 400, clean up your diet, lose some weight, and then you can keep increasing, and that will mitigate those symptoms going forward.
And I want to make a point there. Testosterone replacement, it should make you feel good. Not great, not like Superman. You should just feel a little bit better.
Yeah, if you feel like you can conquer the world, you're probably a little too high. And if what happens too is, aromatization, which is the conversion of testosterone into estrogen, it happens in fat. So the higher your body fat, the more likely you're going to aromatize testosterone. So the level at which you can supplement is lower. So as you go up, it's probably like a stair-step approach. You start a very low dose of testosterone replacement therapy. You work really hard, you lose a little weight, lose a little fat, and then you can bump your dose. You lose a little more fat, you bump your dose, and then you can tolerate until you get to where you want to be 7, 8, 900. And then that's where you'll find out kind of that's your sweet spot. Like I mentioned, my sweet spot's 8 or 900. If I go over that, I'm starting to have some estrogen symptoms. And that's probably because my body fat's at still about 20%, which I'm going to work on getting that down. And then I'll try see if I feel good at 1200. We'll see. So, any points on that, Dr. K?
No, I think you pretty much got it. Let's get to our last point, which is detoxing and how that affects your hormone levels.
Detoxing and how it affects your hormone levels. Well, seems like it would work, right? Seems like it would be good.
Usually tends to work, yeah.
It's funny because every time I go see Dr. K, I have to like take my dosage down on everything, because if I don't, I'll get like massive estrogen symptoms because my testosterone just goes through the roof after I've done a detox protocol or an EBU with Dr. K. So I've got to like preemptively like bring my dosage down because that detox really cleans me up and makes my endocrine system run a lot better.
Yeah. So, if you go back to our heavy metal talk, a lot of these hormones, they mimic minerals and they can block receptors in the body. Cadmium is notorious for affecting, I think it's estrogen specifically, right?
Yep.
So what happens is the cadmium ends up getting plugged into estrogen receptors, and your body, it doesn't know what's getting plugged in. It just knows that, something's in the receptor. So as cadmium's in there, your body says, okay, great, we have estrogen, we're good. And then as you clear it out, all of a sudden your body senses a massive drop and starts pumping out more estrogen.
Yeah. So heavy metals can affect us. We're also looking at things like xenoestrogens and estrogens and from chemicals that are actually 1,000 times more potent than human body estrogens. Things that mimic estrogen from mold. It's really everywhere. It's in all of these toxins, and actually, it's a main way that toxins disrupt our hormones. Is through upsetting estrogen balance. So specifically, when it comes to the person, depending on what type of toxins you have, clearing those will naturally, most likely, increase your testosterone and your hormone levels overall.
So last question, can soy, because I feel like everyone's heard this, can soy affect estrogen levels in guys?
Yes and no.
That's very
So, but wow, this is a rabbit hole. We could go on this forever, but I'll try to make it quick. So soy, the main offender here is not the soy itself, it's the stuff the soy is treated with. So first of all the pesticides and all the mycotoxins that come on the soy are highly estrogenic, and those can definitely affect your testosterone and estrogen levels. Go down and you look at something like the actual effects of pure soy, and it has been shown to exhibit both effects, a minor, and I mean minor, a weak estrogenic effect and a weak negative estrogenic effect. And how that can work is it binds loosely to the estrogen receptor. Sometimes it blocks regular estrogen, which just binds more strongly. And sometimes it causes an increase of estrogen. So it could go either way.
So organic soy is better, ideally?
Yeah. Organic soy is better. You really want to try to find if you're going to eat soy or tofu, you really want to find a source that says, glyphosate residue free, pesticide free. That's really what you want to do. I wouldn't worry about it too much. I would literally just focus on trying to get an organic source. I wouldn't worry about actually eating soy for your testosterone levels. That's not to say, if you're pounding soy protein shakes, 50, 100 grams of soy protein a day, that can probably throw some stuff off.
And for our vegan bodybuilders out there, tofu is a soy product.
It is, yes. Tofu is soy. And I actually had a tofu smoothie the other night. I used silken tofu. It's actually pretty decent. Yeah, it was good. So I was told by my gut results that tofu was a superfood for me. I didn't notice any estrogenic effects one which way or the other. So I wouldn't catch on it too much. You hear all the people going soy boys. And that, that's like a negative connotation term for someone who has a lot of estrogen and it's kind of weak. So, but really, I wouldn't worry about it too much. But if you're going to do it, look for a clean source, glyphosate residue free, organic.
Okay. I think that about wraps it up for us.
That's it. Well, thank you guys so much for joining us. This is Testosterone Part 2. If you have questions or want help with your testosterone or hormone levels, please hit us up on our Instagram, or you can find me on Instagram at ToxinFreeKyle.
And I'm Dr. K, or the OsteoDoc. Thanks, everybody, for joining us. We'll see you next time.
See you next time.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Peak Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.